All right, guys, let's get busy talking about phobias, which are going to be intense fear related to specific stimuli. And this is going to happen for greater than or equal to 6 months. So, some examples of phobias are going to include things like heights, insects, large bodies of water, or air travel. These are all examples you may hear about on step one. Classically, you'll hear about a patient who's like getting on a plane or has to travel on a plane for business or pleasure, and they get intense fear before getting on the plane. This is a classic example of a phobia. Our management of our phobias is going to be cognitive behavioral therapy as well as exposure therapy to the specific stimuli that is causing patients to feel symptomatic. Now, I also want to talk about some really high yield specific phobias that come up again and again on the step one exam. So let's talk out social anxiety disorder. And social anxiety disorder is going to be fear of embarrassment or poor performance in social or work settings. And it's important that we highlight that it is either social or work. These are two classic vignettes that are going to be presented to you, and they're going to be treated slightly differently. So let's go through them. In terms of our social setting type, we're thinking parties, dating, public restrooms. Those are three classic examples. Those are more like socially oriented spheres. And so those patients are going to have the social type of this anxiety disorder. Whereas the performance type is going to involve work meetings, presentations, and speeches. So definitely a much more professional environment is where these people have a performance type of social anxiety. Now, let's talk about the differential treatment. We'll start out with social setting type. This is going to be cognitive behavioral therapy as well as SSRIs and venlafaxine. Now, the performance type, I think, is going to be the most high yield in terms of like treatment. So classically, we use beta blockers, non-specific beta blockers like propranolol. Propranolol is going to be your go-to for these performance type anxiety disorders. And basically, patients are going to take propranolol as needed. So if there's a really important presentation that gives them a lot of anxiety and stress, they're going to take a propranolol prophylactically before that, and it's going to help them manage those symptoms. We can also use benzos, but they have a predilection for addiction, so we like to avoid them if possible. Now, I also want to talk about agoraphobia, which is going to be another high yield phobia. And this is fear related to specific environments. And they're almost always related to spatial orientation and also proximity to other people. So people are either going to be afraid of like really big open spaces or really small closed spaces, and also like lines and crowds. So think places like public transit, movie theaters, stadiums, anything that kind of alludes to proximity to other people and open or closed spaces is really going to affect people with agoraphobia. So what's going to happen here is this is actually going to lead people to reclusive behavior. So they're usually going to stay at home in order to avoid symptoms that are triggered by the environments that they don't like. So our treatment here is going to be cognitive behavioral therapy and SSRIs. So I just want to highlight a few important things in red here in terms of our phobias. So it's important that stimuli are going to be for greater than or equal to 6 months. Also, in terms of social anxiety disorder, we have to differentiate between social and work settings. And then performance type is going to be almost always treated with propranolol, which is our non-selective beta blocker. That is super high yield, guys. In terms of agoraphobia, it's important to note that reclusive behavior and relationship to open spaces, closed spaces, and crowds are going to really tip us off to this diagnosis. Additionally, I want to mention that in terms of our phobias, there's always going to be a specific trigger that is going to lead our patients to become symptomatic. And this is going to differentiate us from panic disorder, which is just going to happen completely at random. And this should help you guys nail phobias on exam day.